I started on dialysis in November of 2014. I do it about 15 hours a week, 3 days, and I consider it really as a part-time job, and I get paid with my life. And I have a pretty good quality of life.
Our sodium research encompasses measuring sodium in the tissue in many places in the body. So that could be lower leg, for example, or abdominal area or the brain. For that purpose, we need to build various coils of various sizes that is particular to that applications. This coil, we have used it for imaging calf muscle in the lower leg, and so far we have used it on over 150 subjects. The next coil we developed was this butterfly surface coil that is meant to be used around the abdominal area. This can image kidney or the heart. For future development, we are interested in looking at sodium in the brain.
Finding association between sodium deposition and clinical markers is not limited to just the calf. We want to prove that tissue sodium is a relevant clinical target in various organs, including but not limited to the kidney and the heart.
Hi, I'm Chris McIntyre, and I've been leading the research module within Can-SOLVE that looks at the importance of salt for our chronic kidney disease patients. It's been an exciting and highly successful project, and I'm pleased to say that over the last 5 years we've managed to build up the capacity with 2 scanners that are able to visualize and measure salt in patients' bodies. This has shown us both the scale and the scope of the problem. This is far more widespread and severe than we previously thought, and we've studied more patients with different types of chronic kidney disease than have ever been looked at before. We've been able to identify the importance of salt in many patients for itch, the importance in how their hearts behave, and for the first time been able to show the important link between salt that's stored in the body and the risk of dying when you have kidney disease. These insights have led us further on to look beyond adults into children, and we now appreciate that children as young as 5 years old can have salt levels in their body that are actually as high as 80-year-olds who don't have kidney disease. We've moved on from studying salt in the leg, where we started, to the very technically challenging areas of the heart and the kidney, both of which have almost never been imaged before within North America. A big impact is whether or not we can change any of these things. And during this period of time, we've been able to look at 3 different treatments for these high salt levels. A different kind of dialyzer. We've performed a randomized controlled trial of reducing the salt level in the fluid, and a revolutionary new treatment to take large amounts of extra salt out through the peritoneal cavity in the body. In terms of outputs, we've been very lucky to take a cohesive group of patients with us through this journey and been able to share with them their images and to understand the impact both being in research and the issue of salt on their lives and their carers' lives. We've been able to extend beyond patients with our first attempts at crowdfunding, so we can allow us involvement and engagement with the public even beyond the sphere of kidney disease. And in terms of outputs, we've been highly successful. We've leveraged nearly $2 million of additional funding from both charitable sources, funding agencies and commercial partnerships. 3 students have been supported, 2 at MSc level and 1 at PhD level. And we've been able to publish 11 papers in high impact journals such as the American Journal of Kidney Disease and general journals with impact factors higher than any of our renal journals such as radiology. So where are we now at the end of it? Well, I think we have a preeminent position in this field both within North America and indeed the world, and I'm excited where that leaves us coming forward to the possibility of the next phase, where we want to take our technology and our understanding and look at 3 key areas. We want to look at discovery, directly looking at salt in the heart and how that drives the heart disease that severely affects so many kidney patients. We want to look at diagnosis. Can we use kidney sodium as a functional test to try and avoid the need for biopsies in adults, in transplants and in children? And thirdly, can we look at evolving our new treatments and use implantable invisible dialysis systems to augment the removal of extra sodium? We've had a great time so far, and we're very excited for us and our patient partners to look for the next 5 years on ahead.